Good afternoon, everybody. This is Jackie Badcock, the UN Resident Coordinator for the Philippines, speaking from Manila. First of all, let me apologize profusely to all of you, including the UNAP Secretariat and the UNAP organizers, but especially to all of you participants for not coming personally to deliver this speech. It's due to the unprecedented weather that's affecting Manila right now and the danger of flash floods, and I need to be in Manila to coordinate any international humanitarian response that may prevail from that. So I do deeply apologize. But let me read my speech to you through this medium, and be assured that I am with you in spirit. Allow me to read the speech. Judge Racina, Chairman of the UNAP, Dr. Angelica Abella, UNAP Vice President, Professor Serafin Aviola, this year's Conference Director, all of you energetic young men and women of the United Nations Youth Association of the Philippines, fellow speakers, delegates, guests, friends, ladies and gentlemen. I've been given the task of presenting to you the global status of the Millennium Development Goals, or MDGs. It's an opportunity that I and fellow MDG advocates surely welcome, but it is also a challenge to encourage active citizenship in pursuit of the accelerated achievement of the MDGs. So please bear with me. The next 10 minutes will be devoted to a discourse on a subject that can be stimulating for some and boring for others. Your being here at this gathering devoted to volunteering for the MDGs gives me hope, though, hope that you all came here wanting to join us in the United Nations and like-minded organizations in speeding up the progress towards eradicating poverty in the Philippines and globally by 2015. The MDG campaign is unique among the non-peacekeeping initiatives of the United Nations. It is the only one in the UN's history with a definite time frame. That time frame, as you all know, is 15 years from that day in September 2000 when 189 world leaders gathered in New York to sign the Millennium Declaration. For the first time in history of the world, nations have come together and rallied around 8 development goals and made them the framework or the blueprint for their country's development. Across the globe, the MDGs have become the rallying point for the world to come and work together. No other declaration or commitment has achieved, declaration or agreement has achieved the kind of commitment and outreach that the MDGs have. That in itself is no mean feat. The 2011 Global MDG report that was launched on July the 7th last month shows that some significant gains have been achieved, particularly in the areas of poverty eradication, education, health, and access to clean drinking water. These are due in part to the continued economic growth of some developing countries and the targeted interventions in critical areas. Increased aid from different sources has translated into expansion of programs for the delivery of services and resources to those most in need. Allow me to elaborate on these gains. I'm pleased to announce that the world is still on track to reach the poverty reduction targets. This despite the economic setbacks that the world faced in 2008 and 2009, which were further exacerbated by the global food and energy crises. The trend is that global poverty rate will fall below 15%, well under the 23% target. This global outcome mainly reflects rapid growth in Eastern Asia, especially China. Unfortunately, in the Philippines MDG 1, this target of reducing extreme poverty by half is still a challenge to be met. there is still more than a third in the population still below the poverty line. On MDG 2, some of the poorest countries have made the greatest strides in education. Burundi, Madagascar, Rwanda, Samoa, Sao Tome and Principe, Togo, and the United Republic of Tanzania. These have all achieved or are nearing their goals of universal primary education. Sub-Saharan Africa is the region with the highest record of improvement in education, with an 18 percentage point gain between 1999 and 2009. This is another MDG that continues to challenge the Philippines. UNESCO estimates that 1.003 million Filipino children aged 6 to 11 years old are not attending school. Apart from the 2.2 million school leavers, another 2.8 million youth aged 16 to 21 years have not completed basic education. On MDG 3, girls are gaining ground when it comes to education, though unequal access persists in many regions. Exceptionally, in Eastern Asia, girls slightly outnumber boys in primary school, and this is particularly true in the Philippines. The National Economic and Development Authority, or NEDA, has indicated that gender parity in education has already been achieved. However, the fact that boys are not in school is still a cause for alarm that should not be taken for granted. And while there are more Filipino women in the workforce than before, they still tend to receive lower wages for substantially the same work that men do. On MDG 4, nearly 12,000 fewer children are dying each day. From 12.4 million deaths in 1990, under 5 deaths have declined to 8.9 million by 2009. The combination of improved immunization coverage and the opportunity for second dose immunizations has led to a 78% drop in measles deaths worldwide. The averted deaths represent 1/4 of the decline in mortality from all causes among under 5 children, and the Philippines is one country that has also made significant progress in this regard. The most recent global estimates suggest significant progress on MDG 5. As a whole, maternal mortality has dropped by 34% between 1990 and the year 2008 in developing countries. But the MDG target is still far from being achieved. Despite progress, pregnancy remains a major health risk for women in several regions, and this same holds true for the Philippines. MDG 5 is one of the most critical MDGs that this country is unlikely to meet, with a maternal mortality ratio estimated at 162 per 100,000 live births, as against the target of 52. The rate of progress necessary to reach the 2015 target is more than 3 times higher than the rate of progress that we've had so far from 1996 to 2006. On MDG 6, deaths from malaria have been reduced by 20% worldwide, thanks to the introduction of critical interventions. The distribution of insecticide-treated mosquito nets in sub-Saharan Africa is sufficient to cover 76% of the at-risk population. 11 African countries have reduced malaria cases and deaths by over 50%. And this has been made possible through joint efforts of governments, international partners, community health workers, civil society, and indeed the private sector. The Philippines has also done well in reducing malaria morbidity and mortality. New HIV infections are declining steadily around the world, especially in sub-Saharan Africa. In 2009, an estimated 2.6 million people were newly infected with HIV. This is a drop of 21% since 1997, when new infections peaked. Increased funding has made possible the expansion of major programs, with the number of people receiving antiretroviral therapy for HIV and AIDS increasing 13-fold from 2004 to 2009. As a result, the number of AIDS-related deaths declined by 19% over the same period. Unfortunately, the Philippines is one of only 7 countries globally where the epidemic has continued to increase, and so much still needs to be done. Effective strategies against tuberculosis are saving millions of lives. Deaths attributed to TB have fallen by more than 1/3 since 1990. From 1995 to 2009, a total of 41 million TB patients were successfully treated, and up to 6 million lives were saved. And again, the Philippines is doing well in its targets for TB. And finally, on MDG 7, every region across the globe has made progress in improving access to clean drinking water. An estimated 1.1 billion people in urban areas and 723 million people in rural areas have gained access to an improved drinking water source over the period 1990 to 2008. Eastern Asia registered the largest gains in drinking water coverage, from 69% in 1990 to 86% in 2008. NEDA has reported that the 85.9% target for access to sanitary toilet facilities has already been achieved, and that the probability of attaining the target of 86.9% access to safe water is very high. However, with 86.9 and 85.9% targets, there remain 10.1 million Filipino households who do not have access to sanitary toilet facilities, and 15.3 million Filipino households without access to safe drinking water. And these, in fact, are amongst the poorest of the poor, the priority targets of the MDGs. The same trend is reflected in the global statistics. Despite obvious progress, we are failing to reach the most vulnerable. While many countries have shown that progress is possible, trends need scaling up, and they should be targeted towards those hardest to reach, the poorest of the poor and the marginalized and vulnerable sectors. The disparities in progress between urban and rural areas remain daunting. Whatever victories we have achieved will be worthless if progress continues to bypass those who are lowest on the economic ladder or are otherwise disadvantaged because of their sex, age, religion, disability, or ethnicity. Consider the following statistics. Opportunities for full and productive employment continue to be slim for women. Wide gaps remain in women's access to paid work in at least half of the globe's regions. The growth in employment during the economic recovery in 2010 was much lower for women than for men, especially for women working in manufacturing. The poorest children made the slowest progress in nutrition. In 2009, nearly a quarter of children in the developing world were underweight. The poorest children were hit the hardest. The trend shows that children living in rural areas of developing regions are twice as likely to be underweight as their urban counterparts. Poor girls in conflict zones are most likely to be out of school. Investment in the net enrollment ratio of children in primary school has slowed down, dimming the prospects for reaching the target of universal access to primary education. 42%, or 28 million children of school age who are not in school, live in poor countries, and poor countries affected by conflict. Over 2.6 billion people continue to not have toilets or other forms of improved sanitation. And where it has occurred, progress has tended to bypass the poor. An analysis of trends over the period 1995 to 2008 for 3 countries in South Asia shows that improvements in sanitation disproportionately benefited the better off, and sanitation progress for the poorest 40% of households has hardly increased. Progress in ameliorating slum conditions has not been sufficient to offset the growth of informal settlements throughout the developing world. The number of urban residents living in slum conditions is now estimated at 828 million, compared to 657 million in 1990 and 767 million in 2000. There have been large gains in drinking water coverage across the regions, but coverage in rural areas lags behind that of cities and towns. In sub-Saharan Africa, for instance, an urban dweller is 1.8 times more likely to use an improved drinking water source than a person living in a rural area. So this is where we stand today. We have to keep striving very hard every day just to be able to stay where we are. What of the future? What are the prospects of our being able to achieve the Millennium Declaration's 8 goals within the 4 years that are left? Everything will largely depend on the attitudes and actions of 2 sets of people. One group is made up of governments. At the September 2010 high-level plenary meeting of the General Assembly on the MDGs, world leaders reaffirmed their commitment to them and called for intensified collective action and expanded application of successful approaches. In this final stretch to the 2015 deadline, government leaders need to be mindful of and to focus on the very basic things that are embodied in the Millennium Declaration. Lives characterized by dignity and decency, enough food on the table, decent living conditions, all school-aged children enrolled in schools, an acceptable level of health care, sharply reduced infant and maternal mortality, and availability of potable water. They should do so with accelerated efforts and without any further delay. The key to much of this effort will lie in better targeting of the poor and vulnerable and localizing the MDG efforts at community level. The Philippine government supports this strategy, and its 4Ps program will also surely help many disadvantaged families in this country. The other set of people upon whom the attainment of the MDGs largely depends is civil society, of which you, the youth, you who are present here today, you are part of this. I urge you not to make the next 3 years 3 days just another social event. Make the 12th International Youth Day Conference different. I hope you will come away from this annual event with a really firm resolve to make a concrete contribution towards the attainment of the MDGs. Your government leaders need to be pressured. Pressure them. They will need to be reminded of their commitments. So remind them. They may need your assistance. So assist them. Remember, time is running out for the vulnerable and disadvantaged. Secretary Ban Ki-moon summed it up best in his global MDG report, which he was launching the report last month. Between now and 2015, we must make sure that promises made become promises kept. The consequences of doing otherwise are profound. Death, illness and despair, needless suffering, and loss of opportunities for millions upon millions of people around the world. We just cannot allow this to happen. Thank you and Mabuhay.